Welcome to Better Health for a Better World, a dedicated podcast series that shines a spotlight on global health projects and programmes supported by the Government of Ireland across partner countries in the Global South. I'm your host, Nadine Ferris-France, and together we'll embark on a journey to explore the remarkable initiatives transforming lives and communities around the globe. This podcast aligns with Ireland's international policy document, A Better World, which serves as a framework for our discussions. Each episode will feature interviews with one or two speakers who are at the forefront of implementation. Get ready to be inspired by the incredible changemakers working tirelessly to build a healthier and more equitable world. In this episode, we dive into the important topic of sexual and reproductive health and rights with specific focus on maternal, newborn and child health in Zimbabwe. Our guests today will cover topics such as HIV and AIDS, adolescent pregnancies, child marriage and gender-based violence as they demonstrate how these issues impact on the sexual and reproductive health and rights of women and girls in Zimbabwe. They will also discuss some of the programs and initiatives that are in place to tackle these issues. Today we welcome three guests to this episode. Vicky Dillon, who is the Deputy Head of Mission at the Embassy of Ireland in South Africa covering Zimbabwe. Dr. Tajuddin Ayewale, who is the UNICEF representative in Zimbabwe. And Ginny Wilford, who is the Executive Director of Say What, a membership-based public health social movement organisation based in Zimbabwe. You're all very welcome today. And I think I'll start, if I can, Vicky. I might start with yourself and just ask you if you could set the scene a little bit about Irish Aid's work in Zimbabwe, a little bit of the background and the history and the partnership with Zimbabwe.
Sure, no problem. Thanks very much. Ireland has a really strong historic relationship with Zimbabwe, and it goes back well over 100 years to the founding of one of the first hospitals in Zimbabwe in Harare, which was founded by an Irish woman, a 26-year-old young woman called Mary Ann Cosgrave, who then went on to become a very famous woman in Zimbabwe called Mother Catrick. And he was honoured in 2007 as one of the 4 women creating Zimbabwe by the Zimbabwean government, which is a huge honour. And she was actually joined by 2 other Irish women back in that time who had opened hospitals in Harare and in Bulawayo. So, the history of Ireland in terms of producing healthcare in Zimbabwe goes back many, many years. And we also have a very strong diaspora link. The Mashonaland Irish Association is the oldest our diaspora association in Africa. And it was also founded in 1891. That was the same year that Sister Mary opened the hospital. So linkage is just going back really, really long way. And I also just want to take the opportunity to pay tribute to another famous Irish missionary, Sister Margaret MacAllan, who sadly passed away in July of this year, but came into Zimbabwe in the early 80s and founded the Mashambanzo Care Trust, which was one of the first clinics providing support to women and children and people living with HIV/AIDS. And at the time, I think she was a really pioneering woman in terms of providing care to some very underprivileged communities. So another example of a trailblazing woman providing support in Zimbabwe. And of course, the government programme has been running since independence in 1980. And we've always had a strong investment in the healthcare system. We also have a partnership with the Royal College of Surgeons, which has invested a lot in building capacity of surgeons, Zimbabwean surgeons, to travel and train in Ireland and then return back to Zimbabwe. And, I think at a meeting with the Ministry of Health recently, that was, credited for having a huge role in extending surgical specialities beyond Harare and Bulawayo and those urban centres into more rural areas. And then we've partnerships with a lot of Irish civil society organisations, Concern, Go, Oxfam Ireland, Christian Aid and Trogra. So huge, really close partnerships and linkages, and with a really strong kind of historical legacy.
Thank you, Vicky. It's so interesting to hear all that history. I've been working in Zimbabwe for a long time myself over the last 15 years and don't know that history. So very interesting to hear that. I wonder, you mentioned HIV and AIDS, and Tajuddin, I might come over to yourself and just we know that within sub-Saharan Africa, Zimbabwe continues to be one of the countries that's most affected by HIV and AIDS, particularly women and children. for UNICEF, how does UNICEF specifically address these, particularly in the context of sexual reproductive health and rights?
Thank you very much, Nadine, for the invite to be on the podcast. And let me also use this opportunity to commend the government of Ireland for the trust and partnership that has spanned more than 10 years or more, working directly with UNICEF as part of the health sector program. We've been through different iterations from a health transition fund to a health development fund, and also now we're in the health resilience fund. And so really also thanks, Vicky, for sharing the history about those great ladies who actually are the forerunners for all of us. I'm really humbled to listen to you and learn from you. From the perspective of HIV and AIDS, Zimbabwe is still one of those key countries in the sub-region that still is addressing the issues of HIV. And that's why in UNICEF, we have maintained a focus on HIV and AIDS. Specifically for us, we look into some key areas of HIV, and I want to point to three. The first is the work we do in preventing HIV transmission from mothers who are positive to their newborn. Unfortunately, as we speak, the estimate for mother-to-child HIV transmission in Zimbabwe is around 8.8%. And that's still high because we really want to get to zero, considering the fact that we know the science, we know what to do, and the antenatal care coverage in Zimbabwe is high. It's around 90-something%. So mothers are making contact with health facilities, and that's the opportunity we have to address them. But why are we having that problem? And that's where the whole adolescent issue comes in. We're having that problem because some of these mothers are adolescent mothers who then face different biases, different constraints, including financial constraints, including socio-cultural constraints, including judgmental perception in accessing healthcare. Not to talk about those who actually must have been abused because of the high prevalence of gender-based violence that we see. The other part of the HIV prevention I want to talk about is the fact that all these contexts that does not necessarily favor adolescent girls pre-exist. That's why the new cases that we see in adolescent girls and young women is actually 6 times higher than what we see in their male counterpart. So a focus on girls continually remain important. I will end by saying that for children who are born with HIV, we also do know the science of what to do. Unfortunately, the coverage of HIV treatment in children is lower than that in adults. We're in the range of 60-70%, whereas in adults, we're in the range of 90-95%. So there is still that gap. And it is not because we don't have the formulas. I think it is more an issue of being able to follow through the mother-baby pair, because then you have to really invest a lot in that. I'll stop there for now, and I'm happy for that contribute. Thank you very much.
Thank you. Thank you very much, Tajuddin. You really set the scene. And it's just that, that just to hear it, the shocking statistic for women and girls, 6 times higher. HIV is 6 times higher, 6 times more likely to affect young girls than their male counterparts. Vicky, I might come back to you just to ask you, with the policy, A Better World, Irish AIDS development policy, how is Irish Aid, how do you see that policy being implemented, particularly in Zimbabwe, for example, in the context of sexual reproductive health and rights, and in the face of these kind of challenges just outlined by Tajuddin there?
Thanks very much. Well, I mean, our policy in Zimbabwe probably aligns very closely with policy of a better world, the government's international development policy. And the challenges that you just mentioned there, Tajuddin, around gender equality are really central to the priorities that we have. And I mean, we really feel that advancing gender equality is a really strong priority for us, not just in Zimbabwe, but globally. And I think that's, that comes apart from our own story as Ireland as well. Like, I think we've really seen that advancing gender equality and ensuring equal rights for women and girls has been a key part of our own kind of economic and social development journey. And we see the same across the world. And in Zimbabwe, a big focus of our program here is supporting gender equality. And it's looking at women's leadership, supporting women's political participation. It's also supporting grassroots women's rights organizations, who we see as very important in advancing gender equality. And of course, working with the government and the Ministry of Women's Affairs to strengthen national gender policy. So, I mean, that's a big priority of our work. And then within that, we obviously have a big investment within the health sector and advancing sexual reproductive health and rights. But I think we really see it as one element of broader work. And we also see the work in gender equality as obviously really having to inform the work on sexual reproductive health and rights as well. Obviously, you know, there are huge issues around early child marriage, around teenage pregnancy, that feed into the challenges in relation to sexual and reproductive health and rights. And they're very much intertwined. So yeah, so gender equality is a big part of our programme. The other areas of our programme, we focus on food insecurity and climate change, building resilience. We also have a big focus on civil society and human rights, and that's been a long-standing focus of our programme. So those are some of the key areas.
Oh, yeah. Thank you, Vicky. Really just painting a picture, and just it's really great for us to see how the policy translates into action, and gender equality certainly is coming out across the different countries that are featured in this podcast series as well. Jimmy, I might come to yourself and just start by saying, you know, a public health social movement organization. It's already interesting, and I think that you're doing such great work and such a great title, Say What. And I just wonder, on the ground, you know, you're the organization that is working with the young people. You're in the health clinics, and you're seeing the needs at the community level. Can you say a little bit about any specific examples or approaches that you take in Say What that really are supporting a comprehensive and integrated approach to sexual reproductive health?
Yeah, thank you very much on that. If you look at the work of Say What, we address public health issues from a non-clinical perspective. And when we are engaging with the community, we are using non-clinical methods to do information dissemination, to do advocacy, and further to do networking and support of the community members in regards to public health matters from a non-clinical perspective. We are dealing with the sexual and reproductive health, maternal health care. If you're looking at the model that we use, generally we use comprehensive models whereby we touch on all aspects to do with the sexual and reproductive health. Primarily, we want the community members to make informed decisions about their reproductive health life by providing the requisite information, adequate information for them to make informed decisions. When you look at the general health system, the general health system in Zimbabwe has got its own gaps that are there. So to support the government in terms of what is being done, we ensure that we provide necessary information to the general public using various methods, peer-to-peer conversations, making use of traditional leaders to touch on issues that have got some cultural connotations. You know, traditional leaders are quite respected, and we engage them to ensure that they are also champions in advocating for good health around the SRHR needs of the community. We're looking at young mothers and young fathers. You know, when we're dealing with young people, these are the future parents, and we are equipping them with the skills such that they are able to make informed decisions in future about their parenthood. We are dealing with making sure that young people, some of them, will try to ensure that they delay sexual debut. They understand what it means to enjoy your sexual and reproductive health rights. More importantly, to make them understand that rights comes with responsibility. You've made a decision. You've invoked your right, but not to it that rights comes with with responsibility? How are you making sure that such kind of things are being done? And lastly, I just want to mention that we work closely with the communities to create demand for health services, demand generation, ensuring that young people or the community in general can be able to access the services. And where are these services found? Thank you, Ona.
Thank you for that, Jimmy. And, just so interesting to hear how the different strategies that you're using. And I wonder, just in relation to what Vicky had said and Tajuddin had said around gender-based violence, what kind of strategies are you using with young girls and young boys, young women and men to change, to change the norms, to change the beliefs around gender-based violence? And what are you seeing as a result of your work?
What I'm seeing as a result of our work is significant progress in terms of young people that are taking it upon themselves to be champions of eliminating gender-based violence from our community and our society at large. We are using two models. One, we have come up with gender-specific a convention or forums for these young people. We have come up with what we call Web for Life. Web for Life is a forum for young women, adolescents and young women. They meet on their own to discuss about the challenges that they face, which sometimes they might find it difficult to discuss in the presence of men. And we've got also what we call Mugota from our cultural setup. This is more like a place where unmarried men sleep, boys sleep, Mugota. So we have got that Mugota forum that is a platform for the young men from the various tertiary institutions in the community as well. These young men, they are equipped with the skills. And before being equipped with the skills, they are taken through a training for them to understand that they need not to be perpetrators of a gender-based violence in our societies. SEWAD has participated actively on the He for She campaigns, whereby these young men have been trained to know that there is need for them to respect or not to tolerate any gender-based violence or any form of violence in our society. Be it the issue to understand the dynamics around sexual harassment, to understand what does that mean. And regularly, we have got champions that we have trained as Web for Life champions. They go around retraining others and mobilizing other young women as well. And in the end of the year, these young men and women, they come together discussing some challenges, common challenges, etc., coming up again with the challenges, with the proposals on how to address the same challenge. Right. So we have used these gender-specific interventions to ensure that the young men has been. Research has shown that men are the perpetrators of gender-based violence. So we have engaged the young men within the tertiary institutions and the community to ensure that they provide leadership in getting rid of gender-based violence.
Yeah. Yeah, that's very powerful, Jimmy. I love what you're saying about just, speaking to the young people themselves and asking them what are the solutions and supporting them to champion the issues among their peers. Really, really powerful. I might come back to you, Tajuddin, just in terms of UNICEF. It would be great to hear about some of the initiatives, the specific initiatives that UNICEF is currently supporting in Zimbabwe, presumably in the schools, out of schools, working with young people. We'd love to hear from you.
No, thank you very much. And let me also thank my good friend from SEWAD, because he brought in a lot of perspective to the discussion. I think I'll share a few examples. The first is the policy work. When we talk about gender-based violence, a concrete example is early marriage. That really destroys the life of a girl child. Before you know it, it's over. And I'm pleased to say that through the technical assistance we provide to the government and we support from all our partners and donors, including advocacy at the parliament level. I'm pleased to say that the child marriage bill in the parliament was adjusted last year, and that is now aligned to the Convention for the Right of the Child. So a marriage of anyone, below the age of 18 is illegal in Zimbabwe. And that is a great achievement because the legal framework is so important in allowing enforcement, follow-up, and the programs that we do. And I'm pleased to say that we've made our progress in Zimbabwe. Another example linked to education was also a product of advocacy and investment based on all the work we've done. And we appreciate the allocation that the Treasury of Zimbabwe is now making on that. Following that advocacy is a provision of sanitary pads in schools, especially in high schools. Because often a time we discount the number of days that an adolescent girls will lose in not going to school when they are on their period. And I think this has become routine in the budget, and we've sustained that advocacy. And I'm proud and pleased to say that this is happening. For sure, we can expand coverage, but it's really a result of collective advocacy, persistent follow-up, and commitment to the girl child. The third example for me is evidence. We all talk a lot about teenage pregnancy, and it's easy to count the numbers. But what are those underlying factors that is driving teenage pregnancy? Post-COVID, but also today. I'm also pleased to say that UNICEF partnered with UNFPA, UNESCO, and then we work with 3 government ministries to undertake a national adolescent pregnancy survey. And that report will be formally released shortly. But that survey not only gives us the prevalence, but allows us to better understand the drivers of teenage pregnancy, and that would then inform action that we can all do. And for sure, I know that the Irish government will be a great ally in advancing these. They've always been really standing with us and all partners in that area. A fourth area I want to bring in is new technology. In 2021, Zimbabwe introduced the HPV, human papillomavirus vaccine into the country. This is a critical investment for the adolescent girls because by providing that vaccination, we're able to prevent a lot of cervical cancer in the future, and we're also able to protect them from papillomavirus and every other form. So this is another area that new vaccine is being introduced. We have support from Gavi, which is also part of that health sector partnership that Irish government is also party to. Now, outside of that, 2 more things I just felt is important to add. How we work with faith-based organizations. Because most of these social norms that we have to address, like was said earlier by my colleague, they are very difficult to address. Trusted hands are required to convey that information. Sometimes they are engraved in beliefs. And we've fostered a lot of grassroots partnership with different religious groups to advance on that. Are we making progress? Yes. Are there challenges? Yes, because the religious groups that we work with, they are not homogeneous. So as we make progress in one, we realize that the work is not yet finished. And it's a gradual process. I call it more a marathon and not a sprint in that regard. I will end by commending the force and the power of young people. Together with our partner, Jandiri, we were able to put in place what we call the Community AIDS Treatment Support Group, comprised of adolescents. And I was pleased to see these young people during COVID, where they assisted their fellow young people to access ARVs, where they assisted their fellow young people to linkages to mental health care services, where the voice to allow that difficult discussion around issues that worries and affect young people. And I think these are very good examples of different dimensions of what we do across different sectors, be it in community or in schools, but more importantly, with young people. I'll stop there. And back to you, Nadine.
Thank you, Tajuddin. That's an incredibly comprehensive, I love that you touched on policy, you touched on systems, you touched on, specific interventions that are happening in schools. You talked about the evidence, new technology, and the faith-based organizations, all so important. And I'm particularly glad to hear you mention the work of Jandiri, who, with my other hat of Beyond Stigma, we also work with and have done for quite some years. And the CATS program, the Community AIDS Treatment Supporters, are absolutely incredible. A force, as you said, a force of young people, for young people, by young people. Vicky, I might come back to yourself, just talking about systems. I think it's really interesting, the health transition fund. We're talking about the teenage pregnancies and the fact that there is a shift in that. But of course, with still a high amount of teenage pregnancies, there needs to be support for delivery which are often complex deliveries. And the health transition fund, I know, facilitated quite an innovative idea of facilitating a minimum of 2 doctors and one midwife in every district hospital of Zimbabwe to try and address the health provider shortage. Can you say a little bit about that? And you're also welcome to comment on anything that you've heard from Jimmy and Tajuddin.
Thanks. No, well, I just think it's a really great example of the kind of broad-based partnerships that we really value as Ireland in terms of the support that we provide to the health sector. And I think, Jimmy and Tajuddin have really kind of explained really well the importance of grassroots civil society, the importance of traditional leaders, of engaging communities and their leadership, but also the importance of government and systems and institutions. And, we've been investing in the health sector through the Health Resilience Fund, which is this current term, and the Health Development Fund, which is its predecessor, around since 2010. And I think, through that investment, we're really trying to support improvements in health at all levels, at the policy level, with the government, engaging on discussions with government around sustainability, around increased investment and supporting the institutions of the Ministries of Health, but then also around delivery. And of course, last year, in the last phase, we supported over 9 million Zimbabweans to access community health services through the UN partners, in particular, UNICEF, and I have to pay tribute to Tajuddin and UNICEF and his team, and of course, UNFPA and WHO, who are our UN partners through the fund, and all the grassroots organisations that they work with. And obviously, we're working with the UK and with the EU as the main investors to this fund. But it's really delivered huge results to millions of Zimbabweans. Just last year in 2022, it helped 96% of facilities maintain above 80% of supplies, and 99% of facilities had over 70% of traditional vaccines. And data from the Zimbabwean census data, I think that we've just got from last year, showed that 1.4 million women access contraception. So I think it's a fund that's really delivering results on the ground. It's really providing concrete healthcare to people in their communities, in particular rural communities and communities through our support for village health workers. We're often reaching people directly where they live, which is also a major challenge in Zimbabwe. So it's delivered kind of huge results, but it's also really focused on this idea of bringing a broad range of actors together to work together. And that's a really kind of central philosophy that Ireland has in terms of the work that we do in Zimbabwe, because we feel, we have to work with government and support government, but we really also need to bring in the bilateral and multilateral partners to kind of have joint action so that we can, address the structural challenges, but also deliver at scale, which is something that I think the Health Resilience Fund has really been able to do. So it's been a great partnership so far, and we're delighted to continue the partnership into the Health Resilience Fund, which is the new phase, notwithstanding, of course, that there are still many challenges facing the health sector in Zimbabwe, and those challenges are immense. So in a way, our partnership is becoming more important.
Thank you, Vicky. Thank you so much for that. And I think, Jimmy, I might just come back to you, the Health Resilience Fund and these initiatives that are really trying to strengthen the health system. How then do you integrate? How do you work with these kind of initiatives in the health centres and mobilising the young people that you're working with?
Well, I think firstly, I will comment on the issue of policy that has been brought up by my colleague from UNICEF. Indeed, there was a great work that was done to ensure that the marriage bill is also adopted and later on become a marriage act, which now outlaws any marriage that is below 18 years. So I think the challenge that we now need to look at is how do we also continue to invest in policy operationalization, yes, we can celebrate that the bill is now a law, etc. But if we look at the preliminary report, the preliminary results from the survey that was led by UNICEF in collaboration with the UNDP and possibly UNESCO, etc., is suggesting that there is still high prevalence of teenage pregnancy, despite that there is a law which outlaws early marriages. So here, if there is a law that outlaws marriage, it does not necessarily mean it outlaws unprotected sex. So how now are we going to work together in making sure that we operationalize, we minimize our assumptions, and we go and hit where the root causes of some of the challenges that we are looking at when it comes to the community and the young people and maternal health, as well as the reproductive health in general. When you're looking at the health resilience fund, yes, when you look at health systems, according to WHO, has got various pillars, 7 of those pillars. Looking at the issue to do with the governance, looking at the issue to do with the human resources, looking at the issue of financing itself, infrastructures, and all those things. So what is more important is how are we riding, or how are we making sure that we allocate each other some pillars to do with the health systems strengthening. We have got a competitive advantage, such that collectively we are able to look back and celebrate that we now have a strong health system. There is an information pillar. How is the information pillar, the dissemination of information, how is it being done in a way that also speaks to the availability of resources, that also speaks to the stewardship of the same, that speaks again to the availability of drugs, and making sure that the human resources, the doctors, the nurses, the basic health care person is available where it's needed. If somebody is to get sick right now, if somebody, an expecting mother is due to deliver, does that expecting mother know where to go? Does the community understand how to support that particular mother so that every pregnant matters? So this is how now we want to look at it, on how are we collectively working together and picking the policies and understanding that we have got the collective responsibility of making sure that the policy gains are also maintained, sustained, and protected, and increment. We do have some increment increasing the successes of that particular policy, not just ticking a box that we have done this, we celebrate. Yes, let's celebrate, but let's also celebrate with all our eyes open, that how do we ensure that this policy is sustainable and going forward?
And I have no doubt that listening to you, Jimmy, that you are absolutely say what and yourself are making sure that in fact policies do turn into action. And thank you for reminding us. Yes, the policies are so important, but how are they implemented, and what is the journey that is required in order to actually roll out and operationalize these policies? Really, really great. And even just, the three of you here today is an example of that collective effort to address all the different aspects of the health system, community involvement, strengthening the health systems, looking at all of the different angles of policy, down to really the community response and leadership. So thank you for that. I mean, this is a fascinating conversation, and there's so much more that I would love to ask you. And as we come to the end of this time together, I guess I'd love to come to each of you and just ask you, for our listeners, if there was a message, if you had one message or a call to action for people who are passionate about global health and creating a better world, what would it be? And Tajuddin, I might start with yourself.
Thanks, Nadine. I think from my part, my closest statement will be more that in the global health community, we have to sustain investment and focus on children and adolescents. And underneath that will be adolescent girls. Because this is a key group that can be easily left out. And this is a key group that we actually need for action. Young people, like I said earlier, is a force. Involving them, engaging them across board will be critical to enabling results that we really want in health and development for children and adolescents everywhere. It's really a pleasure to be on this call, and also use this opportunity to also thank our big donors in the health sector, Ireland, the UK, and the European Union, for their commitment to strengthening and improving the health system in Zimbabwe. Really, it's really great to acknowledge that commitment that we've seen over several years, but also the technical support that they bring into the thinking and into the operation. I thank you.
Thank you, Tajuddin. Great last words. Jimmy, coming to yourself, what's your key message or your call to action that you'd like to leave the listeners with after the conversation today?
Right. Thanks very much. My call to action is that we need to go back to the basics. Look at it this way. We had the Millennium Development Goals, and we moved to Sustainable Development Goals. Right now, there are so many conversations that are going on to assess the progress that has been made under the SDGs. Sadly, there is a risk of us losing the gains that have been made under the Millennium Development Goals and also into Sustainable Development Goals. When you look at this emerging movement, the anti-rights movement, which is in a way, in my considered view, we need to also to guard against the possible reversal of gains that have been made. How do we possibly protect that? We need to go back to the basics. Let's understand the context. Let's minimize our assumptions when we are coming up with response models. Let's minimize our assumptions. Let's not have a one-size-fits-all in terms of responses. Yes, we are in Southern Africa. What works in Zambia does not really necessarily work in Zimbabwe. Neither does it really work in South Africa or Mozambique or Botswana. We need to look at that when we are coming up with our responses. More importantly, I don't doubt our collective capacity to deal with what is happening on the ground. When you look at the civil society, the development partners, and the UN agents, I strongly think that let's not underestimate. I strongly say that let's not underestimate our collective responsibility and the influence that we have on the ground and the opportunity that we have to support the government in what the government is doing through some various development blueprints in various countries. Thank you.
Thank you, Jimmy. Back to basics, loud and clear. We are hearing you. Vicky, last word, coming back to yourself just after this conversation, any reflections and also any message, any call to action that you'd like to leave us with?
Yeah, I mean, a couple of reflections. I mean, we've had a great conversation, and I think, but I still have to reflect going forward. The huge challenges facing Zimbabwe in terms of the health sector are immense, and I think and not just the health sector, but Zimbabwe as a whole. I mean, it really has suffered numerous macroeconomic crises over the last 20 years, and we're seeing that 80% of the economy is now informalized, which has provides huge challenges for public investment in the health sector. And again, hyperinflation, which was a challenge in the mid 2000s, is back again and the thin dollar in the last number of years has really lost its value, and that has a huge knock-on implication for salaries for healthcare workers and vacancy rates for healthcare workers. So I think there are huge challenges in relation to public investment in the healthcare system. And international donors have been working with the government and stepping in, but I think it's really important that we kind of step up the partnership with the government and ensure that there is greater public investment in the healthcare system. And I think underlining some of those challenges, we have things like electricity shortages and other kind of infrastructural challenges that are also, affecting healthcare. So it is a very challenged environment, but I think in terms of my call to action or my key message, would still be, the journey to creating a better world is stay hopeful. And what Tajudeen said earlier, which is prepare for a marathon and not a sprint, right? I mean, Zimbabwe has huge challenges, but if we look at 2006, it had one of the lowest life expectancies in the world, where the life expectancy for women was 37 and for men was 34, which is, a really shocking statistic. And 17 years later, it's now over 60. So we have seen improvements. And I think in Africa as a whole, the life expectancy between 2000 and 2019 increased by 10 years, which is the highest increase globally in that period. So there is progress, but, it's definitely a marathon and not a sprint. And I think the challenges of poverty, the challenges of underdevelopment are not solved overnight. And it takes many, many years to see the gains and impacts of your investments. But I do think Ireland is a really good example of that. Like when we joined the EU 50 years ago, we were the poorest country in Western Europe. And, now we're one of the most prosperous countries in Western Europe. And that's thanks to the building blocks that we put in place, in the 70s and 80s and 90s. And they've really delivered for us. So I think Ireland is a good example of staying hopeful and kind of being committed to the marathon, because it's really a place where we have achieved incredible social and economic growth, but also incredible change in terms of gender equality and social norms and a more inclusive society. So I think, stay hopeful and get ready for the marathon.
Great words. Stay hopeful, get ready for the marathon. And thank you all for together just painting a picture of that really helps us to understand the complexities and of health and development and education, and how these things are so interlinked and all moving at different times. Hopefully moving forward, making sure that we're all actors are involved and that we don't lose hope. So thank you very much. Really, really such a pleasure to be with you today.
Thanks very much.
Thank you very much. Thank you very much. Have a good day.
Yeah, take care. Bye.
And that brings us to the end of another enlightening episode of Better Health for a Better World. We hope you enjoyed our exploration of the remarkable global health projects and programs supported by the Government of Ireland. Remember, by investing in the health and well-being of communities around the globe, we not only create a better world for those in need, but also foster a more interconnected and compassionate planet. We encourage you to stay engaged and to take action, as each of us has the power to make a difference. Thank you for joining us on this journey towards better health for a better world.